So good afternoon and welcome in the next edition of Chat with Caroline. As usual, please use the chat facility on screen to leave any questions. Thanks for those who've already sent in the questions, and we'll read them out during the course of this discussion. I'm now going to hand over to Caroline, who's going to tell you about this week's theme. Thank you.
Thank you very much, and hi everybody. Thanks ever so much for joining us for this chat with Caroline today. As always, please obviously engage in the session and let us know what your questions are, and as always you can continue to ask questions after the chat as well. So I'm delighted today to have different guests with us who I will just ask to introduce themselves, starting with Russell, who's been with us before.
Good afternoon, I'm Russell Patton, I'm the Executive Director of Operations.
Afternoon, I'm Pauline Cullen, I'm the Care Group Manager for Pennine.
I'm Anthony Kenyon, I'm a patient.
Good afternoon, I'm Scott Smith, I'm the Lead Nurse for Pennine Community Mental Health.
Okay, brilliant. So it's great to have you all here today. And the reason the team are with me today is in a moment we're going to talk about the clinical pathway work that's going on in the Pennine area, which is really exciting. But just start as always with an update around things that have been going on across the Trust. So firstly, just to update people about the CQC. So as you remember last time, I said the CQC had been back and had a look at our places of safety and broadly had very positive feedback around the excellent improvement work that's been going on. So again, a very big thank you to everybody. They're about to come back at any time now to have a look at our adult inpatient wards. So just a reminder for people to just keep relaxed, talk about the really good improvement work that you've been engaged in, and thank you very much, as always, for all that work. Next thing just to update you about is the Locality redesign. So you'll remember that I've been talking about this continually for the last few months. So last week at the board, we approved the Locality model in terms of now we are going to have 4 geographical models. So one will be the Bay and South Cumbria. A second will be in the locality of Blackpool and Fylde. The third one will be Pennine Lancs, and the fourth will be Central Lancs and West Lancs. And then the fifth network will be our specialist services. Now we also approved. We had a number of options with one recommendation which we approved, which is how we're going to organise our services within each of those localities. And broadly, we're going to have clusters of teams focusing on access and urgent care, clusters of teams focusing on our wards, and then clusters of teams that will be in the clinical pathway. So adult mental health, older people's mental health, children's mental health, and then physical health community services where we have those community services. So more work is also now going on with care group managers, with service managers to start to co-produce. So what exactly, which services will go into each of those clusters. So please get engaged. There's a series of workshops that are going on at the moment. I know, Russell, you've been involved in those.
That's
Are they going on this week?
Yes, there's a number of events being held over this week and next week, and Lisa Morehouse will be leading those events. The information regarding them has been circulated widely, so I'd be very surprised if people don't know about them.
Okay, brilliant. So thanks ever so much for all of your engagement so far. In terms of performance, there's much to be proud of. I know it's challenging for people. I know the pace and scale of change is enormous. But it was a great opportunity just in the last week to be able to reflect on the significant improvement, particularly in adult mental health services, at the board, in the system improvement board, and on the national calls we've had this week. So really well done to people who've been engaged in that. Still more improvement for us to focus on, but a lot of progress. So please keep going, folks. From a system perspective, there's again a lot of change that is now going to be happening. So there's a consultation at the moment around the 8 CCGs that we have, the clinical commissioning groups merging into one clinical commissioning group at an integrated care system level for Lancashire and South Cumbria. And then the integrated care partnerships to take some of that, quite a significant amount of that commissioning function into very local integrated working, and we'll be a key part of that going forward. Another really fantastic news story, and really we are very, very proud, and thank you all, because I know that this has been a significant target to achieve, but 80% of our staff having now a flu vaccination is really, really positive. It's a significant improvement on next year, and we believe that next year, on last year, sorry, and next year we believe it's going to be even higher, the target. But well done to staff, really, really important. And then 3 awards that we've had in the last couple of weeks. Firstly, the Health Visiting Service in Blackburn with Darwin have been awarded the Gold Standard Baby Friendly Award by UNICEF and the World Health Organization. So really, really well done to you guys. Secondly, we've been down through positive practice to the National Mental Health Collaborative and the Rapid Intervention, our older people's Rapid Intervention teams have been recognised for their fantastic work that they've been doing. And then lastly, and certainly not least, is a significant amount of work that's been celebrated through National Apprenticeship Week that happened recently. And we've got 244 apprentices across the trust, and the team, some of the team were invited down to the House of Commons for the celebration of the excellent work that's been going on. So really, really well done to everybody. Now, more of the improvement work that we're engaged in, that we're going to hear a little bit more about now, is the work that we're focusing in the Pennine Lancs area. I'll ask Russell, who's the executive lead for this, to start us off and talk to us about what's it all about.
Okay. Well, most of you will be aware that we have a strategic partnership with CNTW. That's a mental health and disabilities organisation based in the northeast of England. We've been working with them for some considerable time now, and the latest phase of their improvement work that we're working in partnership with is on pathway redesign in Pennine Lancs in the first instance. So what this will involve will be discrete pieces of work with our practitioners, our partners, our service users and carers, to design what we believe to be optimum pathways to meet the needs of our service users and carers. So some of the areas that we've been looking at in the first instance have been psychosis, non-psychosis and cognitive pathways. We've started in Pennine Lancs, and that was agreed with our ICS partners, and that will be rolled out pretty quickly to the neighbouring ICPs. So very, very early stages, but it's a key development in terms of our improvement journey. And obviously Pauline, who's been closer to the change process, can give us more detail.
Okay, Pauline. So can you just tell us a little bit about the detail? So there've been various workshops that have been going on.
Yes, certainly.
Really
so there's
looking
been
at the whole
five.
pathway.
There's been 5 workshops in total, starting off with our access. So what we absolutely recognised was that there was multiple access points for our service users and stakeholders. So we've looked at redesigning the whole pathway for access. Then that led on to assessment and looking at what would our assessment look like for service users that are coming through, to ensure that that service user only tells the story once, and that there's trusted assessments throughout. Which then leads on to the community offer, so looking at non-psychosis and psychosis pathways, and we looked at NICE guidance, good practice, to look at what would be our blue sky thinking for our services going forward. And then finally was our cognitive and frailty pathway. Those workshops have been run throughout January, 3 days a week, so it's been really intense. We've had fantastic sign up from our stakeholders, Blackburn with Darwin Council, the police, service users and carers, which has been absolutely fantastic.
And commissioners, I think, have been very supportive as well.
Yeah. So the commissioners have been at every single one and really been supportive with the change. It's been absolutely fabulous. To start thinking about what do we want to deliver, and the staff that have been involved in those workshops have really felt that they're being heard, and giving them some hope that things are going to change for the better for delivering services that are a gold standard.
Okay, so should we just come to
Yeah.
you, Anthony? And
Yeah.
what's it felt like? It's brilliant to have had you as a
Absolutely.
user of services.
Yeah, and I
really
think the
being part
staff
of
and
that.
the professionals have always engaged with me. They've listened to me. They haven't. Any idea was a good idea. You know, they're understanding. I just think the passion the staff have, they want to change things, want to make things better for service users and patients, better for carers, and involvement with everything. It was very, very good. Very good.
And have you helped to really think through from a user point of view?
Absolutely,
What difference would it make if we got these pathways in the right
Well,
place?
hopefully, if we get it right at the beginning,
Yeah.
it's better outcome at the end.
Yeah.
And we might have to keep going in services, in and out of services, get it right at the beginning, get the right support, get the right care, get everything right at the beginning. Again, like I say, they might not have to go in. I've been in services for a long, might not need an inpatient stay, might just need community help, and might be able to get back into the normal daily living and things and deal with mental health better than being long stays and in and out of services where things are not always good, and just getting community services right really for them.
So particularly, what could we be doing more to support you staying at home, keeping well?
Well, I think the ideas have come up with like, so I think one of the ideas was about having the acute mental health team working longer, not just 9 to 5. And I think also people maybe, so for me, depots, if I was working full time, I might be able to take my depot injection during the day. So if I had working at 8 o'clock or for instance, or whatever time, that helps me carry on my daily living, but also helps keep me well with the depot. So there's good ideas with that and health checks, because when people are unwell, when on some psychotropic medications, they can have a big impact on your physical health. A lot of people wanted to keep an eye on physical health. I think that was good to really wanting to get the physical health right as well as just mental health, because a lot of time in services, in mental health services, it's always about mental health. I've seen a lot of time. In general side, it's all about general. We need that integrated working, you know, for both things. And and like, they want to keep both off hospital, so they want to have the right support and not too much support, but not too little, and needs led and best for that service user or patient.
That's absolutely fabulous. And I guess, Scott, coming to you as the lead nurse, a lot of these new ideas will might take a change in practice for people, change in working hours for people. So what sort of engagement has happened with clinicians and with staff?
So over the 5 workshops that we've had over the past 7 to 8 weeks, it's been really, really good for me as the lead nurse to have staff involvement right from ward level, right from community team level, right up to sort of lead nurse level, care group manager level. And what's been really positive is that everybody's really got involved. Everybody's really been able to put their points across, and everyone's been really creative in how they're thinking about developing these new pathways. And what's really important to me is that these pathways that are being delivered and being created are being delivered by staff, and they're being clinically led, and this is what staff want. And what's really good, and what we heard at board last week, is that these new clinical pathways are being supported by the board, which is really important to us as frontline staff to know that we're being listened to. And moving forward, we know that over the past couple of weeks we've had further operational planning events, and we are involving staff. We've got future planned engagement events with all our staff, making sure that people's voices are heard, that people are constantly involved in the development of these new clinical pathways, which again is really important.
And I know I've been along to some of the workshops. I know Russell has, and certainly there's been a list of things to ask us about. So clearly we're getting a strong voice around what people expect and want for the future.
Absolutely, and I just feel really privileged to be part of that whole process.
That's fab, and it was so great to have you to the board last week, and the positivity was just fabulous. Russell, did you want to?
I think it's really important that the genie's out of the bottle now, that we've talked about staff engagement and staff involvement in designing things, and I think that's clearly the direction that we as a senior leadership team want to instill, going forward. We'll never be in a position now where we can say to staff, thank you very much for your involvement, but then no longer come back to you to say, help us develop things for the future. It's out there, it's how we're going to do things. And it's the right thing to do.
Yeah, indeed.
Absolutely.
So have we got any timescales on when this might start to be implemented? Because obviously we're starting with one area at the moment, one locality. There's a plan to roll this out across other localities. Are we going to wait till we develop those models and then we'll implement? What's the ideas?
So we had a workshop yesterday, and Louise Giles, with all our stakeholders and clinicians, met to look at what are our quick wins. So we talked about laptops being delivered. So we know that laptops will be being delivered to all our community services in April.
Fabulous.
We also looked at digital dictation that is going to be rolled out to our START teams and our mental health liaison teams in the interim by May. So we were able to design a plan of what are our early wins. We know that our access point is probably, as we all agreed, that is our one that we really want to move forward with very quickly. And we looked at that being having an interim plan, so that could we get started within the next 3 months to be starting to look at getting more admin staff in, maybe looking at more practitioners to try and get that work started. But then there's a long-term plan. So the long-term plan was being made up from Louise Giles's team that's going to be coming through to Ursula, Martin and yourselves for consideration.
Okay.
So
there are things we can get started with,
Definitely.
and then there'll be and things like, I know that when I went along, that making sure that we've got the right digital equipment out
That's
there
right.
was a really big enabler. So that's great to hear that that's now in place, and digital dictation is part of it. And then we've got to redesign that whole front door access.
Yeah, and I know that our estate colleagues are looking at the data about referrals to look at where would the buildings best be placed for service need.
Okay.
So that work is going on in the background.
Fabulous. So really thinking broadly. Great. Have we got any questions that have come through?
I had a couple in, Caroline, if I may talk you through those. And while you're answering, anybody who's looking, if you could look into this camera for me here
Okay.
as well, perfect.
The right camera's very important.
It's all very important, absolutely. So this is quite a long one, so bear with me. This is from Elaine, and it's aimed at you, Caroline. She says, I work for Pennine RIT, RITT, which, as you may be aware, is an award-winning team. I think you mentioned that earlier. On this week, mentioned the Positive Practice Mental Health Collaborative Report. I took part in the recent workshops. The one thing that wasn't clear to me from the workshops was where those who were functionally frail, for want of a better term, sit. This wasn't ironed out. For me, having worked in both the adult and older adult crisis home treatment teams, I strongly believe that the functionally frail should sit within a separate crisis/home treatment team specialising in functional, frail and dementia caseload. From my perspective, the FF, I'm not sure what that means, but FF do not sit well with functionally frail, I think, yeah, thank you, do not sit well with the general adult patient group, as their needs are very different and actually more similar to dementia patients. I'd like to know your view on this. Thanks very much.
Okay. So I guess my view needs to reflect what the majority clinical view is. And I know that we'd had a lot of discussion and debate as we were developing the new structure to make sure that we kept those pathways glued and connected in. And for example, the older adult pathway, we didn't want to start disaggregating something that was already working. But I'll go along to maybe yourself, Scott, or Pauline.
I can take this, that's fine.
Great.
I guess from the RIT perspective, as Caroline said earlier, they're an award-winning team, and I guess working through the workshops, it was widely recognised that this is a really highly functioning team, and why break a team that's working really well? And if we look at what we can take from a team like the RIT team and maybe replicate how well they're working in some of our other teams, I think that'd be a really good positive journey to take forward, especially from my point of view in terms of our locality. So going back to the locality redesign and how things are going to look in the future, I guess it's about sort of looking at the RIT team, looking at the older adult pathway, and ensuring that pathway is seamless for our patients accessing the service. And it has to be, for me, from a clinician and from a lead nurse, it has to be absolutely service user need based on what their needs are. So if somebody needs a function like the RIT team, then let's go for that, and let's continue with the way we're working. And if we need expertise from other teams, then that's something that we can also look at and link in better with our other services.
Okay, thank you very much, and really, really well done, by the way, for being recognised and award-winning. Well done.
Thanks for your question, Elaine, as well. This one's a little shorter. This is from Gail. It's fantastic to see frontline staff attending workshops. How do you intend to continue to keep frontline staff included in the transformation plans? moving forward in order to keep staff engaged in the process.
So thank you, Gail. Really, really important. And as Russell said, the genie's out of the bottle. But I'll go to Pauline just for in terms of, so how are we going to ensure, particularly with the Pennine work, that this isn't just a one-off?
So I think we've done the workshops, and our commitment to the staff and to our stakeholders is that everybody will be involved in developing those pathways and developing that service. There's been some engagement sessions out to 3 of our community teams, so Balladon, Daisyfield and the Mount, looking at what we've done to try and get further engagement from our staff, because not all our staff could go to the workshops.
Right.
So we've got feedback coming through those channels as well, and we're absolutely committed to not only work with our staff but work with our service users, carers and stakeholders, the police, council and our GP colleagues, to make this work.
Okay, brilliant. So really strong commitment from all of us, from the board to clinical team level, to continue to really co-produce and engage folks. And have we got one
more question,
Great.
And it's again from Gail. Staff attended the transformation feedback drop-in sessions. It was concerning regarding the data analysis, as this did not give a true reflection of the amount of referrals and contacts within the RIP team as a whole. When staff asked a question and asked for explanations regarding the data figures, they were told not to worry too much, as they were aware the data was not relevant. I don't know if that's a question or a statement.
Okay, so clearly an issue there around the data, and I don't know if anybody is aware of that as an issue. So thank you, Gail, for raising it. Something that we will take away and make sure that we put a response. It is important that we have accurate data, as accurate, and of course our data can only be as accurate as the people inputting it on the front line. But it's important that we use data and triangulate that with clinical opinion as we start to redesign services. But we will put up an answer to that, and thank you very much, Gail, for raising it. Okay, so that comes to the end of our chat with Caroline this week. Our next one is on the 12th of March, and that's all about our digital plans. So please do join us, that'll be great, and thank you very much.